Clinical revalidation of Puerto Rico. Clinical questions on muscarinic agonists, pyridostigmine, physostigmine, donepezil, edrophonium. 1. A 65-year-old man with myasthenia gravis is prescribed a long-acting acetylcholinesterase inhibitor to improve muscle strength. Which of the following drugs is the best choice? A. Physostigmine. B. Edrophonium. C. Pyridostigmine. D. Donepezil. Answer C. Pyridostigmine. Pyridostigmine is a long-acting acetylcholinesterase inhibitor used in myasthenia gravis to increase acetylcholine at the neuromuscular junction, improving muscle strength. Shot 2. A 22-year-old man presents with symptoms of atropine overdose, including dry mouth, mydriasis, tachycardia, and confusion. Which of the following medications should be administered? A. Pyridostigmine. B. Physostigmine. C. Edrophonium. D. Donepezil. Answer B. Physostigmine. Physostigmine is a reversible acetylcholinesterase inhibitor that crosses the blood-brain barrier, making it the best antidote for anticholinergic toxicity, e.g. atropine overdose. 3. A 70-year-old woman with Alzheimer's disease is prescribed a medication to improve her cognitive function. Which of the following drugs is the most appropriate choice? A. Pyridostigmine. B. Physostigmine. C. Donepezil. D. Answer C. Donepezil. Explanation is an acetylcholinesterase inhibitor that increases acetylcholine in the CNS, improving cognitive function in Alzheimer's disease. 4. A patient with myasthenia gravis is given a short-acting acetylcholinesterase inhibitor to differentiate between myasthenic crisis and cholinergic crisis. Which drug is used for this purpose? A. Pyridostigmine. B. Physostigmine. C. Edrophonium. D. Donepezil. C. Explanation. Edrophonium is an ultra-short-acting acetylcholinesterase inhibitor used in the Tensilon test to diagnose myasthenia gravis or differentiate myasthenic crisis, improves with edrophonium, from cholinergic crisis, worsens with edrophonium. 5. Which of the following conditions is most likely to improve with pyridostigmine therapy? A. Parkinson's disease. B. Alzheimer's disease. C. Myasthenia gravis. D. Organophosphate poisoning. Answer C. Myasthenia gravis. Explanation. Pyridostigmine is a long-acting acetylcholinesterase inhibitor that improves neuromuscular transmission in myasthenia gravis by increasing acetylcholine at the neuromuscular junction. 6. A 55-year-old man with myasthenia gravis experiences severe muscle weakness after increasing his pyridostigmine dose. Which of the following tests will help differentiate between a myasthenic crisis and a cholinergic crisis? A. Ice pack test. B. Edrophonium test. C. Tensilon test. D. MRI of the brain. Answer B. Edrophonium test, Tensilon test. Explanation. The Tensilon test with edrophonium helps differentiate between myasthenic crisis, weakness improves with edrophonium. Cholinergic crisis, weakness worsens with edrophonium. 7. A patient presents with pinpoint pupils, bradycardia, excessive salivation, and muscle fasciculations after working on a farm. Which of the following medications should be administered? A. Pyridostigmine. B. Physostigmine. C. Donepezil. D. Atropine. Answer D. Atropine. Explanation. Organophosphate poisoning, pesticide exposure, causes excessive cholinergic stimulation. Atropine, a muscarinic antagonist, blocks muscarinic effects, bradycardia, salivation, bronchoconstriction. 8. Which of the following medications is a central-acting acetylcholinesterase inhibitor used in Alzheimer's disease? A. Pyridostigmine. B. Physostigmine. C. Donepezil. D. Edrophonium. Answer C. Donepezil. Explanation. Donepezil is a CNS-active acetylcholinesterase inhibitor that enhances cholinergic neurotransmission in Alzheimer's disease. 9. A patient with myasthenia gravis is experiencing muscle weakness despite pyridostigmine therapy. Which additional medication can be added for immunosuppression? A. Prednisone. B. Atropine. C. Donepezil. D. Edrophonium. Explanation. Myasthenia gravis is an autoimmune disease. Prednisone, a corticosteroid, or other immunosuppressants, e.g. azathioprine, are used when acetylcholinesterase inhibitors are insufficient. Tash 10. Which of the following is the best treatment for an atropine overdose? A. Pyridostigmine. B. Physostigmine. C. Donepezil. D. Edrophonium. B. Physostigmine. Explanation. Physostigmine is the antidote for anticholinergic toxicity, e.g. atropine overdose, because it crosses the blood-brain barrier and reverses central effects. Key takeaways for medical revalidation of Puerto Rico. Pyridostigmine, long-acting treatment for myasthenia gravis. Physostigmine reverses anticholinergic toxicity, crosses BBB. Donepezil, used for Alzheimer's disease to increase CNS acetylcholine. Edrophonium, used in the Tensilon test for myasthenia gravis diagnosis.